Hello and welcome to my channel. I'm Dr. Grudnikoff. I'm a psychiatrist practicing in New York. This is the first discussion in the series focusing on autism and autism spectrum disorders. I hope to make 7 or 8 of these recordings to cover the topic more extensively and comprehensively. I will include discussions on the evaluation of children with autism, early intervention, medications, alternative treatments, and behavioral emergencies, as well as how to navigate the complex and somewhat broken healthcare and educational systems for children and adolescents with developmental disabilities. So this talk is an introduction to autism, where I'll talk about how autism is understood by people who've studied it, by physicians, and the terminology that's involved. And I will also talk about future topics in this series. This talk is aimed at parents. It is critical that parents of children with autism learn as much as possible about this disorder, this illness, to become the best possible advocates for their child. A quick example, I guess, of why, just to kind of put it in perspective, why it's important to know as much as you can. So, for example, parents of children who have had autism will ask about a brain scan, CAT scan, and MRI to try to nail down the diagnosis or to find the cause. Sometimes that's important and sometimes it's indicated, but most of the time it's not. And parents often feel slighted, or they get into kind of power struggles with doctors when doctors say, well, that's not really what we want to do. And some parents end up going to private clinics that will charge out-of-pocket cash to scan, to do elaborate scans and go over the results with a physician. And I think a lot of these evaluations have minimal clinical relevance. This is in contrast to an area where it is much more worthwhile for parents to direct their energy and their money, which is early intervention. So high quality early intervention is hard to find. When parents have energy and resources and time to get that for their child, this is a much more important and much more necessary intervention, or to fight for than for example, something like a brain scan for most kids with autism. So that's why it's important for parents to I think know the latest information about autism. Again, to know where to put their time, energy, and money, to be frankly honest. So about how autism is understood and what it is exactly. Autism is considered a neurodevelopmental disorder. This is a critical concept, and we'll come back to this a number of times. It is critical to understand this both for the diagnosis and for proper treatment. Neurodevelopmental disorder means autism, and broader idea of autism spectrum disorders and pervasive developmental disorders are disorders of development of the brain, which means it happens early in the child's life. In fact, for moderate to severe autism, a lot of the symptoms and signs are present in the first year or 2 years of life, while symptoms that are more subtle can go undetected until later. It's important to think of it as a developmental disorder because it is during that period when intervention and treatment is most effective. As a quick example, if child has speech delays, you wouldn't think to wait until they are 15 to get them into speech therapy, right? If a child is not speaking by the time they're 2 or 3, parents and pediatricians will get them into speech therapy right away, because this is when brain is developing, and this is, if it's not developing normally, this is when interventions will be necessary and effective. The second part of why thinking of autism as a neurodevelopmental disorder is important is because other neurodevelopmental disorders frequently come with autism in a package. They are co-occurring or comorbid in kind of medical terminology. Again, if part of the brain is not developing normally, which is autism, it's likely, and maybe even more likely than not, that some other areas or functions of the brain are not developing well. And that could mean ADHD, which is a neurodevelopmental disorder. It could mean intellectual disability, which is a neurodevelopmental disorder. It could mean speech disorder, or learning disorders, which are all disorders of early development of the brain. And a few words about terminology. So the DSM-5, which is the Diagnostic and Statistical Manual used by American psychiatrists primarily to diagnose mental illness, uses the term Autism Spectrum Disorder. And in the latest edition, this is supposed to encompass and include all more specific descriptions of this illness that are now believed to be best understood as part of this broad umbrella term. And those more specific disorders that are not used in DSM-5 include things like Asperger's, infantile autism, atypical autism. World Health Organization, by contrast, still uses those terms. And depending on who you ask, there might be some value in distinguishing, specifically which subtype of autism a child has. According to DSM-5, it is more useful to focus on the actual impairments. What are the actual needs of the child, rather than get lost in an academic discussion. Is it Asperger's, or is it some other subtype? Few words about just a general understanding of the symptoms of autism. So the symptoms of autism fall into 3 categories with some overlap. The 3 categories are problems with social interaction or socialization, and this ranges from mild, things like not making eye contact, not following, not being able to follow a conversation, or being able to shift conversations for older kids, or not being able to make friends, to more severe symptoms. That's social interaction. The second one is communication, which is a little bit related to social interaction, but is different. And there's a range there also. There's a more severe problems with complete lack of language and communication, to again more subtle presentations. And finally, the third group of symptoms involve restricted or repetitive interests and behaviors. And this again ranges from things like rocking or abnormal movements, which children often use to soothe themselves. Somehow it makes them feel better to rock or clap or do something with their hands repetitively, which normally developing people don't do and would find strange or odd. or have very specific interests, being overly preoccupied with a topic, trains, dinosaurs, or being stuck in certain with certain routines or needs, kind of having to eat in a certain way, or being sensitive to certain clothings, or finally, management of autism involves early intervention, but in a broader sense, it requires a multidisciplinary approach. There's no medication that treats autism. Many interventions often involve speech, occupational therapy, special education to make the child's educational needs, and social skills groups if a child has significant difficulty making friends, or being in the classroom, etc. And medication may be used for more severe behavioral symptoms such as aggression or self-injury. There's also a number of alternative treatments, diets, supplements that have been tried with varying success, and we'll discuss a little bit of this in the future videos. So this was a very general overview and an introductory talk about autism spectrum disorders, and I think the most important thing to take away from this is that autism is a neurodevelopmental disorder, and this informs both diagnosis and treatment. If you have any thoughts or comments, please leave them on this video. Please subscribe, and let me know if you have any questions. I'll try to address them in the future videos. All the best.